quick, and I can give you the tour.
Okay.
So what would you guys do? Normal day in practice? Or do you...
That too, and then we're gonna talk about men's health month.
Okay. So with this is our practice. Welcome to Kasraeian Urology.
This is great, Dr. Ellie. Love the digs.
So these are actually my brother's paintings.
Ooh.
My brother, my younger brother, seen it.
Your brother painted that?
Yeah, he's an orthopedic surgeon, but his hobby is painting.
We're looking at Dr. Ali's brother's paintings. It's real life right now. Okay. Love it.
So we are live at Kasraeian Urology. It's a little different. You guys are accustomed to him being on the show every Thursday, but now the show is on him today. Chat's on hiatus, but we want to keep you guys going. And we wanted to see what he do in his time. What's his day like? Usually he rushes in on the chat, 5 minutes till blowing his hair back, and he's on set. But I want to come into his world today. So that's what we're going to do. See his office, see his staff, see what they really think about him. We're going to hear it firsthand.
One of our viewers said very impressive, Dr. Ali. She likes The Office.
Nice. Very nice. Oh, nice break room. Look at the fancy chairs. Very nice. Oh,
The grand tour.
Break room.
So this is my dad's office.
Wow. Your dad works in here?
Yeah, my dad and I work together. So I don't know if anyone knew that. I'm very blessed to actually work with my dad, who's been a urologist for many, many, many years, decades. He started in Jacksonville here in 1986 after being a professor of urology all over the world in academics. And the story is he had a position at an academic institution at UC Irvine.
Oh, wow.
And my mom was here at the University of Florida, and Dad was home for Christmas break. And when he was going to leave, we're kind of deciding which coast to live in. And we're going to actually move there. My brother and I stood in front of the car and started crying. So my dad left, and he did a lot of cancer operations. Went and did a cystectomy, which is an operation to remove the bladder.
Oh, wow.
Handed in his resignation, and very shortly after came here and started a solo private practice, which he kept solo until I joined him in 2008. And that was a big deciding factor for me not to do.
You're going to make my eyelash come off because I'm about to cry. That is so awesome.
Yeah, so that's a big reason I didn't do academic medicine, is to join my dad and get to operate with him. So
well, we're glad you're here. We're glad we're glad you got in front of that car, you and your brother.
So we're very proud of our practice. And
You should be.
How long have you been at this location, Dr. Ali?
So Dad's been here probably 5 years or so before I got here, so early 2000s, mid-2000s. I finished my fellowship in Paris in 2008. I did all my training at the University of Florida. I did a fellowship at the Montsouris Institute in Paris in laparoscopic and robotic surgery, and I did some ablative stuff like using ultrasound energy to treat prostate cancer as well. And then came here in 2008.
You're smart.
No.
Wow.
I'm lucky.
So since you mentioned you spent so much time in Paris with your education and your training, what do you think of all these terroristic things that's happening there now?
I'll tell you, it's really, really interesting. For that, that very question hit home for me because remember the Bataclan that was the Paris when they did that terrorist where they went into the conference?
Yes.
I used to see shows there every 6 to 8 weeks. So and it was really heartbreaking because those are regular people and kids, and actually one of my attendings had friends of his lose children there.
Wow.
And so actually on my radio show, I had him call in and talk.
Nice.
And it was one of those solidarity things. He's like, they're not going to, we are going to fight, and these type of activities are not going to keep us from living our life. What I find difficult with these terrorist things that are happening is that they are happening everywhere, and it's becoming our new normal.
But that's unacceptable.
And it's not unacceptable. One thing that we talk about on the show a lot, that Stop the Bleed campaign, a lot of this stuff came from the fact that it is becoming our new normal. And the Hartford Convention, where the American College of Surgeons got with everyone involved in the delivery of trauma care, and they found that when something happens, there's a lot that can be done right there before people get to the hospital, and what is done on the ground can get people. We see that in Boston. A lot of the things that they got people to the hospital very quickly got people to become to arrive in a situation that can allow them to be safe. And Pulse, same thing.
Oh my gosh,
One of the things with Pulse that was amazing, it was right there near, it happened very close to
a hospital. Yeah.
If that wasn't the situation, it may be a
been worse.
different story.
Yeah.
So the Stop the Bleed campaign is an amazing thing where people can go to stopthebleed.org, the American College of Surgeons website, and learn how to take the steps to do that yourself. Because unfortunately, that can happen anywhere.
For sure.
The sad part is that people think that that's okay to do. And as a physician, where we spend all of our time trying to think about ways to make things better, to not have that happen, it's a very strange mindset to think about people that are on purpose trying to create havoc in people's lives and create death as a message. That's strange for me. I don't understand that.
It's unfortunate.
You know,
it's so unfortunate.
You know, and that's very strange. And hopefully, we can figure out a way through taking care of each other, our neighbors, people we care about.
Which is what we need to do more of. Connect with your neighbors and spend time with them, and you know, put the phones down, put the games down, and connect with your people. Because eventually, one day, you may need those people to help save you, or vice versa.
I'll tell you, I think Americans, and I think the world does a great job of rallying together and being amazing.
After tragedy.
After tragedy.
Yes, I agree.
Why can't we be like that all the time? Stupidity and dumb things happen, and we all fall back into the same things we complain all the time. When things like Jacksonville, we were amazing in Matthew. I know from my own life.
Oh yes, we were. Oh my gosh, yes.
We were spectacular. This city was great. I know for myself. I was on call that weekend. It was a very busy week. My parents were out of the country, and very quickly, what's important becomes crystal clear.
Always.
It's so nice. And it's such an important thing, but it doesn't take long until
to me, it's kind of refreshing, because I've had a few moments recently where what's important changed for me, and what a relief. The little things that I used to worry about, I don't even care anymore. It is what it is. You know, it really is. So is your dad actually here right now?
No, I wish. We fortunately, our practice is busy enough that we have multiple offices, so it kind of doesn't make sense for both of us to be here all the time.
But that's a picture of him.
Yeah, so
that's you and your dad.
There he is.
Dad is a very handsome man. Ow.
Dad is a very handsome man.
Oh, look at that. I see the resemblance. Nice. His name is Ahmad, Dr. Ahmad.
And I'll show you one thing that's interesting that my dad carries around that I didn't even notice was in here. I was a drummer in a band in college.
Oh my God.
Oh my God. And this is why we're here. To see this.
Shut up.
This is happening.
Dr. Ali, you've been hot since you've been beating drums. Ow, yes. Look at your hair.
I love it.
Shut up.
I love that it's on display too.
This is so awesome.
That is so great. Love
Dr.
that.
Ali was beating the drums. So nice. Very nice.
We've had your mom on the show too. A smart doctor as well.
She's over at University of Florida.
Yeah, she's the chair of pathology.
Yeah, awesome. Very blessed family, I would have to say. Oh, that's an interesting picture. That's a conversation piece right there for sure.
My dad used to have a picture of a horse's head there, and Mom very quickly changed that.
Yeah.
So
she's my kind of girl.
We can thank her for that.
So on an average day, how many patients would you say you see?
So it's interesting. Our clinic probably sees between us and our three. We have two PAs. Brooke, who works with me. Kristen, who specializes in female urology, incontinence and pelvic floor issues that women have, and she's great. Brooke is amazing. Her and I deal with mostly cancers and complex kidney stones and things like that. And Dave Forbes, who works with us, he specializes in general urology and andrology, which is low testosterone levels, erectile dysfunction, and things like that. And Dad does general urology, and then him and I do our big open cancer operations together.
Wow.
So we probably see about 100 plus patients, more than that actually, between all of us in clinic. Dad probably sees about 50, 60 patients. I see probably about 25 to 30 cancer
and that's
patients.
per day?
Per day.
Wow.
Mondays and Tuesdays I operate, and they're a mix of smaller, probably 7 or 8 small cases, or one or two big cancer operations.
So let me ask you this.
Or a mix.
Because you deal with the type of specialty that you do, and you do so many operations on these cancer patients, what is your mental state when you go home?
I'll tell you, for me, the challenge with this stuff, the diseases we deal with and all that, I find that exhilarating. The medicine part, I love.
Okay.
If I could be in the operating room 24 hours a day, 7 days a week, I would. The thing that I'm finding exhausting and more challenging is the logistical aspect of what you're doing.
What do you mean by that?
Paperwork has gotten amazingly complex. And again, I'm not some fossil, but the computerized technologies with the electronic medical record, studies have shown it decreases productivity of doctors by 25 to 43%, but they're not efficient. You're spending a lot of time just clicking away at computers. If you go in the hospital, doctors and nurses are just sitting around computers, and the notes that are generated aren't great. So I find myself calling doctors a lot more as I'm rounding through the day. So today my day started around, on a typical day, your day starts around 6:30, 7 o'clock. We round to the hospital to see our patients. We've either operated on or got consulted on. And we're on call for one of the hospitals this month. At any point, they can call and say, we need you to come do this. We drop everything, close clinic, and you got to go take care anytime at night. So it's a big sacrifice in your day-to-day life, and you're used to that, so that's your normal. That's a big sacrifice for our families and things of that nature. No one seems to understand that, and it's assumed. It's what we do, we love doing it, but when the logistics of the practice of medicine and the things you see in the political field, healthcare reform, and those, never really appreciate or comment on how to make that better in a way that not only helps patients, not only helps in terms of healthcare cost savings, in a way that everyone comes to the table and has interesting conversations that move forward. That for me is frustrating, and I'm part of organizations that go to Washington and talk about these things, and it just seems like constantly you're having circular discussions that get us to the same place we are today. Like today, Senate released their health care bill, and it'll be very interesting to see
what happens now.
What happens now. So I urge people when they kind of look at these things, to keep in mind that the focus of healthcare should be the patients, and it should be the people taking care of the patients, because we are the healthcare providers, and the patients are the center of all this. And figuring out how to pay for it has to be intelligent. And a lot of times they compare everything to European nations and things like that. When your country's 5 to 8 million people, it's a lot of different conversation when you're treating 330 million people that aren't the healthiest people in the world.
So when you are not here working, here or at the hospital, wherever, what does Dr. Ali do to have fun or to unwind?
So for me, my fun, used to be music, and I played in a band, I wrote, I sang, and I used to be a fairly competitive athlete. I almost played professional soccer. I was a competitive tennis player, and that all stopped, unfortunately, after medical school ended.
Because this is where you were supposed to be.
Well, I guess. I mean, it was a lot more fun doing that.
Yeah, I bet you missed the courts, am I right? Get back to tennis. Let's look up as you're answering that.
But I'll tell you
So
now,
what else you do?
honestly, just spending time with friends and family.
It's like going out, hanging out?
Yeah, I mean, honestly,
That's
and traveling. I love to travel, and one of the things that I'm very, very blessed that my job has afforded me is the opportunity to travel to some amazing places. They tend to be a lot of times for work, but you try to tack on a day or two here to kind of see the scenery. Those days here and there seem to be dwindling with that, but that's one of the things I love to do is travel, because you get to experience different things and different perspectives, and that, I think, especially nowadays, is invaluable, because it puts everything in a nice perspective that we can bring home and share.
Nice. So we all know that this is Men's Health Awareness Month. For those men who may be watching, for those wives, sisters, aunts, whatever that's watching, what is the one most important thing that they need to be aware of that can help the male in their life this month?
Think about your health, and think about the health of the people that you care about. And with men, you got a difficult task. We are stubborn.
Really?
And it's a two-way road. Sometimes the women are stubborn too, but men are tough to come to pain. A lot of times we see men getting dragged in by the women in their lives who love them, and we have to make it a priority. So for the men who are watching, think about your health not as much for yourself, which you should, but you want to be around to walk your daughter down the aisle. You want to watch your grandkids be there. You want to be there to support your family. So screenings, for me, I talk a lot about prostate cancer screening and things like that. You don't want to miss the opportunity to catch something early where it's nothing to worry about, as opposed to when it's too late and we can't do anything about it because there are no cures for cancer out of the prostate.
Now, what about those men, when these women in their lives try to get them to come to the doctor to get their prostate checked and all that, and the men say, oh, you're nagging me. How do we get around that?
Well, women seem to have very amazing ways
y'all quick to say, quit nagging me. But it's out of love.
It is. Well, I mean, that should be a topic for the chat. And we should probably have Trent and I on the panel for that.
Yeah, right.
That's nice.
It's a difficult discussion because I would assume that men would probably have something to say about that, and women probably have time where men are hounding them about other stuff. It has to be something where both sides of the conversation are open, that it comes from a place of love. And really, for everyone to think about health, screenings and going to the doctor have to be part of your life plan, because if you miss the opportunity to catch something when it's early, we really miss an opportunity that can be life-saving. The other thing is regular stuff. We're talking a lot of times screenings and seeing the doctor in discussions about cancer. But think about regular stuff: blood pressure, heart issues, diabetes, cholesterol levels, those type of things. You don't want to show up when your blood pressure is 180 over.
I'm having a hot flash, y'all. Y'all know
It's always this time.
Always.
Yeah.
Would you like some more?
No, just gotta breathe through it. This is called getting old, Dr. Ali. So
you want to do the things that keep you healthy, and a big part of being healthy is making sure that you pay attention to the things that will keep you healthy. And some of those things you can't just walk around and feel. You can't walk and sense your blood pressure.
So here's a question. So you know how there is, every month we have the Genie Buddy Check 12, the 12th of the month we do the breast self-exams. And that can kind of help get ahead of if there's any challenges. Is there any type of self-exams that can be done on the male prostate area?
That would be a completely different type of buddy check.
Yeah, you have to be a real buddy to check
I'll tell you, I mean, all kidding aside, one of the things that men can do is a testicular self-exam.
Okay, so there is such thing.
So you can check your testicles. Now, it's interesting, most self-exams, the U.S. Preventive Services Task Force and different organizations don't recommend, because there's no study that shows that it makes a difference. However, I always boil down to common sense. For what man, and even for breast exams for women, there's no studies to show that there's a benefit for women doing the self-exam themselves.
Really?
Yeah. But how can you tell a woman that it doesn't make sense to just check your own breast, and if you feel something that's different, go talk to a doctor? From a common sense standpoint, it doesn't make any sense. From a scientific data standpoint, the concern there becomes you find something that's nothing and you open the door to false biopsies and procedures that you don't need. You can understand that. But being aware of your own body, as someone who knows your body better than anyone else, makes a whole lot of sense. So for men to have to discuss with them checking your testicles once a month seems like a very ridiculous discussion, because if you're not doing that, then we need to have a discussion about hygiene and things of that nature. So while you're taking a shower, at least once a month, have a dedicated check of your testicles, just between your thumb and your forefingers. Feel all the way around. Make sure that there are no lumps. There's no excess weight that you're feeling. Make sure there's no bump or a mass. Essentially, is what you're feeling from that standpoint. If you have any kind of pains or discomforts, that's usually not cancer. If you're feeling a testicular pain or discomfort, obviously you should go see your doctor, because you may have an infection or something of that nature. But any changes that you notice that you're not comfortable with, go see a doctor.
Now, what age should they start doing that? Should they be concerned about it?
So, interesting thing, for testicular cancer, the ages where they're most predominant are in the adolescents.
Really?
Yeah, so this is something where people at the beginning of before teenagers and things of that nature, they should be doing that. So parents need to talk to their children about being very keenly aware of doing that, to make sure, especially if they've had a history of an undescended testicle, meaning when they were born, their testicles were not down in the scrotum. And with that, usually they would see a urologist. They would do some kind of procedure if they haven't been descended down all the way. and they would have to monitor that closely. So be mindful. That's one male self-exam that you can do. The other self-exam that again is controversial from the recommendation standpoint is your skin.
What about it?
Cancer.
Really?
You want to look at moles, the ABCDEs, if it's asymmetric. You want to look at borders. You want to look at the color, if it's very dark, if it's bigger than the eraser on a pencil, the diameter, the size. You want to see if it's evolving, if it's changing in size. You want to be mindful. You want to have a full body look at your body to make sure if anything's changing, you're mindful that you go see a doctor. Now they talk about again having a yearly examination and looking at your whole skin by a physician is not necessarily recommended by the U.S. Preventative Services Task Force, but most doctors who deal with melanomas and dermatologists and surgical oncologists need to be mindful of that. And actually last week I had Dr. Scott Lynn, who's the new chair of surgery, the surgical oncologist at UF Health, was on my show talking about this very topic. And I'm rerunning the show this week. I'm out of town operating it.
Okay. That's on WOKV Saturdays from 5 to 6.
104.
Shout out.
Hey.
Conversation Jacks. Follow on Facebook.
So, you know, when these young boys are going to be playing some type of sports, they have to go and get a physical first to get clearance. Is a prostate exam part of that? And if it's not, should it be?
No. So when we start checking for prostate cancer, usually it's sometime after the age of 40. And again, that's a very controversial aspect. The new U.S. Preventative Services Task Force gave prostate cancer screening with a PSA test a grade C recommendation, where before it was a grade D recommendation. The way to kind of think about that, before they say don't screen, said the harms outweigh the benefit. Now they changed that to a grade C recommendation, where they said see your doctor and have a patient-centered discussion about the risk and benefits. What I tell people is it makes sense to check your PSA in your 40s.
And that's a prostate-specific antigen,
yeah,
correct?
prostate-specific.
You can go to your physician and ask him.
Your
It's a
primary
simple
care
blood
doctor.
test.
Have a discussion with your primary care doctor if you want. You can talk to your urologist. We talk about this stuff all the time. It's a test, and they find that PSA in your early 40s by 45 is the most predictive of your risk of prostate cancer in your lifetime. If you're African American or if you have a family history of prostate cancer, risk of prostate cancer is higher, and the risk of potentially having a more aggressive prostate cancer if it's left later on in life in the African American population is higher. And unfortunately, lethal prostate cancer is higher for reasons that we don't quite completely understand. So starting screening earlier in the early 40s by 40 has been recommended by some groups in the idea that if something's going on, catching it earlier allows us to be mindful of what we got going on and intervene in a time where a life-saving procedure may be more impactful than if we find it later on.
So what does it mean?
Can we walk one more time as we wrap up these last few
I'll
minutes?
show you one cool thing that we
great.
do here on the other side of it.
Oh, there's another side. Wow. Oh, wait. Oh, shoot.
We'll see.
Hey,
This time.
what is your name?
Jasmine.
Hey, this is Jasmine, y'all.
Hi,
Jasmine.
Jasmine. You're on Shots Facebook Live.
Hey, you're on Facebook Live right now. So, cute glasses, by the way.
Thank you.
So, how awesome is it to work here?
It is awesome. I've been here 4 years.
Oh, really?
Well, it must be awesome.
Okay, it must be awesome.
Hey.
Isn't Dr. Ali, with the Ali's, aren't the Ali's awesome?
They are. They really are.
Yeah,
They're
all
a
of
pleasure
them.
to work for.
Oh, that's so sweet. So sweet. All right, Jasmine, thank you. Carry on.
If you're just joining us, we're at Kasraeian Urology. We're with our special guest, Dr. Ali.
Hi.
Hi.
Hello.
She acting like she's doing some work. She ain't doing nothing.
I'm sure you're hard at work.
What's your name?
Jasmine.
Wait.
Is that two? Okay.
Wow. Hey, Jasmine.
Glad you're both here.
All right. So here.
Oh, look at this. This is the Monday.
This is the room.
So this is one of our procedure rooms. And so here what we do is we do a thing that's called a fusion biopsy. And so with this program,
This is the room.
One of the
At
many.
least there's a TV. Is that a TV for entertainment or is that for
No,
entertainment?
so the interesting
Oh.
thing about this is, here, let's see if I can
Thanks for weighing in, everybody. Keep sending your questions.
Send your if you have a question you want to ask for your husband, for your son, whomever. We're here with the doctor. He would love, Dr. Ali is such a sweetheart. He would love to answer your questions. So if you have anything, post it right there. We'll read it and we'll try to get you an answer.
Amen. Dee said, of course, our friend Dee said, I love that Dr. Ali's dad is his inspiration. Thanks, Dee. Martha says, your overall knowledge is amazing. Thank you, Martha. Patty, thanks for watching.
Hey, Patty.
Look at this.
Wow. So this is where technology has taken us to where you can see this right in front of you.
So with this, the interesting thing that we do here is, and we were one of the first groups in the small groups in the country outside of academic institution to have this called a Urinav system. Is
Uronav. Okay.
Yeah. So what we used to do in the past, I'm going to show up here if you want to see, is before when we did a prostate biopsy, we just randomly biopsied the different areas. Now we get an MRI scan, and we find this tumor here.
Oh, that's a tumor.
Yeah, so that's a tumor within the prostate.
Oh,
and
my.
so then what we do...
That's kind of big, isn't it?
Well, relatively speaking.
What is that, a golf ball?
So here's the prostate. So here's the bladder.
Where? Oh, there you are.
And
Okay.
this white portion
Okay.
here. This darker portion here is the prostate. And you can look at it in multiple phases. So this is like we're looking through the person with the feet looking out at you, kind of the head behind the TV. This is kind of with the head up, feet down, left, right. This other one here is if we're looking from the side, with the head up here, the feet down here, up, down. And so with this, we can plan how to directly biopsy into this tumor, merging the MRI and the ultrasound images together.
So this is breaking technology right
I mean,
here.
we've been doing this now for almost 4 years.
Here at Kasraeian Urology.
Yeah, and so with this, we're very proud of it because now the next step of this is we can imagine the possibility of doing focal therapy. So if this gentleman, if this was the only portion of the prostate that had the cancer, we could imagine the idea of just treating that and using the MRI to potentially do what's called a fusion-guided focal therapy.
Wow.
So MR guidance, so it allows us to become stronger. And we're at a paradigm shift where we're beginning to think about this like the paradigm shift of doing a radical mastectomy, where they would take the whole breast and big surgeries for breast cancer versus the lumpectomy, where we just took the tumor and did radiation to the base. So now we're kind of thinking, can we move the paradigm that way for really low volume, low risk, specific, low to intermediate risk cancers in very specific cases. Again, it's not for everyone, but we're looking at this in a different pathway.
So let me ask you this, because I hear of it so much. What does it mean, and is it an indication of anything if a male, once they reach 40 plus, they start going to the bathroom a whole lot more?
Good question. So anyone Googles prostate cancer, they talk about urination type symptoms. Fortunately, most difficulties with urination are associated with a non-cancerous enlargement of the prostate. So, for example, if you kind of look here, this middle portion of the prostate here, not this portion, but this middle portion of the prostate here is a non-cancerous part of the prostate that grows. It's called the transitional zone. It's called BPH. And so that, after the age of 40, all of our prostates grow. And if you can kind of imagine your prostate...
So that's normal. So
Yeah.
don't get scared if your man, if he's 43 and his prostate's grown, it's nothing to panic about.
So fortunately, it tends to happen a little bit later on.
Okay.
So if that middle portion grows, people may notice their stream's weaker, they're growing more frequently,
Okay.
more urgently, they're waking up a little
And that's
bit
part
more.
of the growth.
Part of the growth.
Okay.
Now it's variable for some people. It grows more than other people. Sometimes some people have big prostates and they don't have as much problem as people that have smaller prostates and it's bothering them more. So it's variable. But that middle portion is not usually cancer. You can have cancer there, but that growth is not usually caused by cancer. If you have symptoms related to prostate cancer, it's probably fairly significant cancer.
Okay.
And you can have enlarged prostate causing difficulties with urination and cancer together, and they can be going on at the same time. Think your prostate is an orange. So you have this middle fruit portion and the outside rind. The outside rind tends to be where cancer lives, and the fruit is where the growth causing difficulties with urination can happen. And when we do procedures, people think about the Roto-Rooter procedures called a TURP, or a transurethral resection of the prostate. It's kind of like us going with a spoon and carving out the fruit to open up the channel. And there are a variety of different ways to do it. There's a new procedure called Urolift, where we can kind of go in for smaller prostates and put sutures in to open up the channel. There's a thing called Resume that Dad does, where in the clinic you use steam to open up the channel in a few minutes. So amazing,
my gosh.
amazing technology.
You are so smart, Dr. Kasraeian.
No, we just get to
Wow.
get to do a lot of cool stuff to help people.
Would you prefer to be doing this or beating drums?
If anyone wants to give me a record contract, I would be very happy.
Oh, so you would walk away from this?
You wouldn't close up shop though, right? You're saving lives. Okay, we won't say that live. So Patty has a question for you. Does the Gaines waves work on someone that's had a prostatectomy? Is that...
It depends.
Okay.
I mean, it depends. Like I said, with prostate cancer, one of the challenges with this stuff is that it's so personalized. So we have so many different treatments. We have so many different things that one of the challenges with prostate cancer, especially when people kind of think of out-of-the-box therapies, especially when people start pursuing more holistic measures. If you think about prostate cancer, one of the ways that we look at the stage and grade of prostate cancer, it's measured and looked at in this thing called the Gleason score. So a Gleason score is when you look at the cells under the microscope, the pathologist assigns a grade from 1 to 5 to the most common area, adds it to the second most common area, also score from 1 to 5. They give you a total score, ranges from 2 to 10. 7 is kind of this fence that divides aggressive cancers like 8, 9s, and 10s from less aggressive cancers like 6, 5s, and 4s. Most common things we see are a combination of 6s and 7s. So 6s in the low volume are the things you talk about people monitoring, active surveillance. So if someone has a low volume, low risk prostate cancer where we can monitor, and about 45% of our prostate cancers these days we monitor with active surveillance. PSAs every 3 to 6 months, we repeat the biopsy in a year. How we talk about what to do for that cancer is much different than if someone has a very aggressive prostate cancer.
Number.
So doing holistic measures and avoiding standard of care therapies for the aggressive cancer can be profoundly dangerous. If you're thinking about some other things with lower risk cancers, it may not be quite as dangerous because if we just monitor it, your statistical likelihood of dying of that disease is really low. With active surveillance, it's an important discussion because I think this changes one of the controversial paradigms of prostate cancer. Prostate cancer was criticized that we diagnosed all these cancers, everyone got treated with side effects, and not everyone that got treated necessarily died of the disease or needed the therapy. And so a lot of people may not have needed therapy. So the way I think about cancer, prostate cancer, is you have 4 types: rockets, rabbits, turtles, and snails. Okay? So rockets are the prostate cancers that are out of the prostate when you get the diagnosis. Fortunately, very rare, less than 4% of the cancers. Although that number is going up now that screening is being done less.
Okay.
Rabbits are cancers that have legs. So these are the cancers that we need to treat, and we need to treat them while they're confined to the prostate to prevent them from getting out of the prostate and becoming rockets. So the reason we screen for prostate cancer is to catch the rabbits. Turtles and snails are these slow-growing, slow-moving cancers that may or may not have any impact on people's lives. So if we diagnose those, we can monitor them. And big studies have been done. A big study came out, more than 3,000 patients followed for 11 years, and found that people in active surveillance for this low-volume, low-risk disease, more than 99% of those guys didn't die of prostate cancer. More than 99% of the cancer didn't get out of their prostate. However, a third or so, their cancer changed over subsequent biopsies within a 5-year period of time. So we need to monitor it. So it doesn't mean you have a low-risk cancer disappear. So again, you have to engage with your physician. It's a team approach. You do that. So what we do depends on what we have and how it changes. So that's important to know from that standpoint. Some of these tests, like the MRI scan, there's this another test called the 4K score, a lab test that gives you a percentage risk of higher risk disease, are actually designed to avoid unnecessary biopsies. So we're really trying to not just lump everyone to do these procedures. We're trying to be smarter. And that's where you talking to your doctor makes a lot of sense.
Talk to your doctor, people. It is Men's Health Awareness Month. Please, if you have a loved one, brother, uncle, husband, your boo thing, whatever it may be, show them love by caring about their health and getting them to care about their health and checking. And not just because it's the month of June, but even moving forward for the rest of the year, we've got to make sure that everyone stays healthy. Spread love. So speaking of spreading love, as I wrap this thing up, I want to know more about you. So, would you prefer Chick-fil-A or Zaxby's?
Zaxby's.
Really? What do you order?
Actually, you know what? I would prefer Chick-fil-A.
Okay.
I should probably eat Zaxby's.
Why?
Oh no.
From the health standpoint.
Okay.
I look at you giving me a doctor's answer. Okay.
So
I thought Chick-fil-A is like the healthiest fast food.
But it's still fast food.
Yeah, but it's so good.
So remember we covered this last week. the world obesity thing that they were talking about, the biggest contributor to all that stuff is high
that good fatty food.
The good fatty food, and one of the big things are fast foods from that standpoint, high energy foods. But the chicken nuggets,
Right.
Yeah.
And when I did my residency, there was a Chick-fil-A.
So you wore them out.
Lived there.
Yes, I can only imagine. What's your favorite color?
My favorite color is blue.
How did I know that?
Well, I wear a lot of white, but I like blue.
Yeah, blue looks really good on you.
Thank
Red
you
looks good on you too. Okay, well, Dr. Kasraeian, we're going to kind of walk through and kind of get out of here and let you get back to work.
Thank you so much for coming in.
Thank you for letting us into your world for a change. We really appreciate it.
I'm glad for having me on every week. It's one of the most fun things I get to do.
Aww.
He's making me blush. That's
I'll tell you,
awesome.
for the guys, think about taking care of yourself as an important part of taking care of your family. Because if you're not around to take care of your family, that puts a lot of strain on your family. And when you are sick, it wears on your family because they look to you for a lot of things. Much the same way as when women get sick, it wears on the family. So it's really a team approach.
Taking care of each other.
And I really think women and men and man and men, whoever your family and your support, which that fortunately is changing in a much more accepting way. Whatever your unit and your family and your people are, your boos are.
He just said your booze. Oh my gosh.
I'm learning. Do things together because we need more of that. People need to really take care of each other better because I think the world is a little bit on the grander scale forgetting that. And we're seeing the negative aspects of this because I think we are, whether it's the 24-hour news cycle, whether it's all these things, all of this going on.
A box of gloves? Wow. Can I have a glove?
You can have it.
So what do you want with?
I don't know, but I have a cut on my hand that I need to wrap up.
Facebook viewer.
This is so ghetto that I'm asking the doctor for a glove. But hey, it's real. No.
We have pink gloves too.
You have pink gloves?
I'll get you some.
Okay, we'll get those
How
on our way
cool
out.
is
Dr.
that?
Ali, someone says, have you had your PSA?
Ooh,
Me,
called him out.
I'm actually getting my PSA this year.
Okay.
That is,
Okay.
it's
Is
on
it
the
your first
books.
time?
Me? No, I've had it before.
Okay.
But,
Yeah.
Wow. Ooh, I love that you called him out, whoever it
No,
was.
Because, you do all your...
I'll tell you, I'll share with this with everyone. I'm a
Awareness.
diabetic, and so I get
Type 1.
Type 1,
And I'm
I've
type
had it since
2.
I was a child. So my endocrinologist is on top of my labs, so I get labs quite frequently.
I could say
Yeah.
the same.
I'll tell you though, I worry about the same things that everyone else worries about with screening and everything like that. Because
Do you?
Because you're a guy, you don't want to do any of this stuff.
So speaking of which, what keeps you up at night, Doc?
The fact that my work takes me away from my family, not having enough
Shout
time.
out to Addie. What's up, Addie?
I think she's watching right
not
now.
having enough
Hey,
time.
Addie.
Maybe.
Oh.
Not having enough time, the balance of time, and the fact that I like to do a lot of stuff besides just work within the work realm. Like the show and my radio show and things like that. And when you pile on extracurricular stuff, the only time you can do it is at night after work, because I don't have time during the day. I start my day around 6:37.
And what time does it end? What time do you get home?
I mean, usually 8, 9 o'clock. We've been on call. I've been getting home 10,
It's a
11
long
o'clock
day.
every day.
That's
you
a
know.
long day. Wow.
know.
Well, thank God for supportive wives. Thank you,
Yes.
Addie, for
Thank
taking
you.
care of my
Thank you.
boo right here. Thank you.
Thanks, Dr.
what a wonderful- We should
Ali.
do this more often.
For
We
sure.
should. There we go. Come to your world.
So yeah, listen
And
to
we can
Dr.
see the
Ali.
Jasmines again.
Here they are.
Thank you so much,
yeah.
Dr. Kasraeian. I appreciate
Next time
you.
we should go in the operating room.
Oh, I love it.
He would let me in the OR.
Maybe with the
Would
gloves
you let
on.
me?
I mean, Channel 12 should get okay. Be very
Yes, we're totally
Oh,
down.
I would so do that. I
That's
would
very fun.
so do that.
fun. They're in the
Yay!
hospital. Bonnie.
Nice.
Love it. Bonnie,
Bonnie,
she's watching.
shout out to Bonnie.
So we'll see Dr. Ali. Your usual day's Thursdays with us, right? Thursdays
Yes.
on the chat,
Yeah,
3
break
o'clock.
Mondays and Tuesdays.
Okay, breaking news Tuesday.
nice.
But yeah, watch us on NBC, and then over the weekend, listen to you on your radio show on WOKV.
Absolutely. Busy man.
Melanoma, skin cancer.
There we go.
Oh, nice.
Big topic.
That's what's going on next week?
This Saturday.
This Saturday. Okay, great. Once again, thank you. Thank you guys for tuning in and watching us, trying to keep you informed, even though we are on hiatus. Stay tuned. We're going to bring you way more stuff. Henny and Trent has a little tea to give you later on today. Y'all stay tuned.
Thanks, guys.